My name is Scottie Briscoe, and I am a patient of Dr. Cash. I had several injuries on my back a couple of years ago. I had a car accident and injured my back, and then I suffered some pain throughout that period of time. And then 2 years later, I was picking up my grandson and my back snapped. And then I was unable to stand up straight, and I limped, and my pain was excruciating from there, from my hip down to my toes. Some of the everyday things, for instance, driving was getting extremely painful for me, and driving my stick shift was a very hard thing towards the end, and I've always driven a stick shift. Not only did I have physical pain, but emotionally I was a wreck. I was overweight. I couldn't lose weight. I couldn't exercise to lose weight. I was feeling like the pain was so bad that I thought that was how my life was just going to be.
My name is Sophia Briscoe, and I'm Scottie's daughter. My mom really had a passion for gardening, and whenever I'd go off to college, I would look forward to coming back and seeing all the pretty little flowers that she'd plant, because she'd always plant different ones. She would never plant the same little pansies or the same pink flowers, but when she got hurt, she wasn't able to do that as much. So in my visits home from college over about 6 months, I would see my mom's pain progressively get worse. Over Christmas break, around the time that it first started happening, she didn't seem like she was in too much pain. Maybe she'd take some Motrin and then she'd be okay. But once it got worse over maybe spring break, it started to get progressively worse. And then summer came, and that's when she was barely able to walk.
Hi, I'm Gino Briscoe. I've been married to Scottie for about 30 years. She would walk, take a few steps and limp, and you could tell the wincing on her face that she was in some pretty good pain. There's a lot of things that she couldn't do, such as lift heavy objects, stand for a long time, or even sit for a long time. She always had to adjust her hips and move around. I knew at the time Scottie had a lot of physical pain when she was moving about, just walking normal activities. I knew then that it was time to see the physician and see if there was any action that could be taken to correct what was going on in her body.
Hello, I'm Dr. Andrew Cash of the Desert Institute of Spine Care. I'm a board-certified, fellowship-trained orthopedic spinal surgeon. When Scottie first came to the office, she was really a wreck. She had suffered from back pain for years. Over the last several months, it was getting so debilitating, she had pain, numbness, and tingling going down both legs. And she had tried almost everything conservatively that she could.
When I first arrived at Dr. Cash's office, I thought it was very neat and clean. The setup was nice, and the decor was beautiful, and surgery is always a last resort for him. And so when I did try the pain management and it didn't work, then I came back to Dr. Cash's office and I talked to him, and I told him I wanted him to fix my back. And at that point he knew that surgery was the option for me. Surgery went really well. I felt nothing. I had no pain when I came out of surgery at all. I was ready to go. I was ready to move.
Scottie has kind of directed her own rehabilitation after she had done physical therapy. She's logging like 5 miles a day. I've seen her at the gym several times. She goes more often than I go, and she's certainly logged a lot more miles on the elliptical and the treadmill than I have. She's done miraculously.
After the surgery, there have been a lot of positive changes in Scottie. She goes to the gym and works out quite often. She's been walking and exercising more than she has ever been, really.
We get to go shopping now, and we get to try on all the new clothes that she looks even better in than she did before.
So after surgery, I asked Dr. Cash what I could do to exercise, and he told me that I could walk. So I decided I would walk. I went during physical therapy, they had me walk on the treadmill. When I was done with physical therapy, I decided I would continue walking. So I started walking 1 mile at a time at the park. I'd walk around the track, and I increased that gradually up until 5 miles a day. And then from there, I joined a gym, and I started walking 6 miles every day. After the surgery, I had worked out so much that I started losing weight. I lost over 40 pounds, and I have a lot more energy than what I had before. Having Dr. Cash do this procedure on my back has completely transformed my life. I'm a new person now. I feel brand new. My back feels great. I can do whatever I want to do now.